From CBS 2 News, this is a special report.
Charlie, did you say something to offend somebody over there? Or, you're all by yourself. Brett, same for you, I might add. I can imagine. Good afternoon, everybody. Not exactly the Easter weekend that Irving Berlin, Fred Astaire, and Judy Garland envisioned an Easter parade in 1948, but here we are on Easter Saturday. I'm honored to be joined to my right with the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli. Judy. To her right, State Epidemiologist, Dr. Christina Tan. Dr. Tan, again, thank you for being with us. And another guy who does not need any introduction, the guy to my left, the Superintendent of the State Police, Colonel Pat Callahan. I also want to acknowledge Jared Maples, the Director of the Department of Homeland Security and Preparedness, Deputy Counsel Parimal Garg, who's with us, as well as other colleagues. Thank you all for joining us. I got Pat's permission and blessing, so I'm flying NJ Transit Police colors today. So I want to give Chief Chris Tresillo and his men and women a big shout out for all the great work they do. And I promise you I'm still loyal, as you know, Pat, to the state police, and I'll find my state police garb, I'm sure, sooner than later again. So let's get to the numbers, as we have been doing up front of late. Since we met yesterday, we have been notified that 3,599 more residents have received positive test results, and the statewide total now rests at 58,151. Again, 3,599 positive tests since yesterday, and a total so far of 58,151. And Judy will correct me here if I get this wrong. According to our online dashboard, accessible through covid19.nj.gov, as of 10 p.m. last night, 7,618 residents were reported hospitalized, of whom 1,746 were listed in critical or intensive care, and 1,650 ventilators were in use. And again, for the 24-hour period ending at 10 p.m. last night, another 682 residents were discharged. As we noted yesterday, the dashboard, again, covid19.nj.gov, the dashboard pulls data as it is reported each night by hospitals to the New Jersey Hospital Association. There may be overnight changes or late reports that are not yet reflective in that data. It is just, remember, a snapshot in time, and as we know, this is a very, very fluid situation. I'd like to note, however, as we did yesterday, that while the numbers of our fellow residents in the hospital, in critical or intensive care, and on respirators is daunting, there are hundreds of people literally each day leaving the hospital, people who have beaten to one degree or another, including those who are going to so-called step-down facilities, or some who are going straight home. We've got a lot of those as well. Those are folks who have gotten to a much better place, and we have to keep remembering that. This should give us hope, especially in this season when our spiritual lives are filled with a sense of renewal. Sadly, however, we continue to lose members of our tremendous New Jersey family to COVID-19 related complications. And over the past 24 hours, that number was 251 blessed souls and lives lost. We have now lost a total of 2,183 members, extraordinary members of our extraordinary New Jersey family. For every single one of them, we stand in solidarity and prayer in mourning their loss. Our flags remain at half-staff in their honor and in their memory. Here are just a few, and I wish we could say something about each of the 251 lives we lost overnight and the 2,183 lives we've lost from the beginning of this crisis. But here are a few of their stories. Viola Richardson, there she is. She served the people of Jersey City for 12 years as a member of City Council, first as the council member of Ward F, and then as council member at large. But before that, she was a Jersey City police officer, tough and outspoken, a fighter for her community and her city. Her life defined the meaning of the words, public service. And Jersey City has paid a big price in this. I was back and forth on text this morning with Mayor Fulop. Our hearts and prayers go out to him, other members of the council, and the extraordinary residents of our great Jersey City. Another guy, John McCarthy, of my town, Middletown, was an Army veteran and a small business owner and leader along our Bayshore. He was a longtime member of the Hazlitt Business Owners Association, the Northern Monmouth Chamber of Commerce, and the Bayshore Senior Center in Keansburg. He also coached youth baseball. We lost him yesterday. Our thoughts and prayers are with his wife, Donna, and their family. God rest his soul. And that's a great shot with a grandchild there of John. And one more today. Here's Martin, known as Marty Fox, from Milburn. He was 2 months shy of his 96th birthday, but what a life he packed into his years. Amherst College, Harvard Law, and a U.S. Army lieutenant in the Second World War. A passionate crusader for social justice. During the long, hot summer of 1963, he went to Florida to represent pro bono members of the St. Augustine Civil Rights Movement. He was appointed to the New Jersey State Board of Education by both Governors Richard Dick Hughes and William Cahill. And in 1978, he accompanied his friend, Governor Brendan Byrne, on a trip to Israel. He never slowed down. To his wife, Muriel, and his daughter, Sarah, with whom I had the honor of speaking earlier, and Rachel and their families, we thank Marty for his lifetime of service. God rest his soul. He will not be forgotten. Now, this is not new today. I mentioned this yesterday, but we owe you to see a picture, to put a name with a face. Here is a picture of Nelson Perdomo. God rest his soul. I mentioned, as I said to him yesterday, I wanted us to pay a proper tribute to Nelson. He was a 19-year veteran corrections officer. Our prayers are with his wife, Fanny, with whom I spoke yesterday, and their kids, Emma, Maya, and Tito. God bless them all, and God bless his memory. Tremendous lives, tremendous people, tremendous families, tremendous holes in our broad and diverse New Jersey family. This is a toll in real lives that the virus is taking on our state. It is for them and for every family that we are committed to defeating this invisible enemy. And we must do it together. It's not just up to some of us to continue our social distancing. It's up to all of us. I know hearing the daily numbers can be scary. I know there's continued anxiety as we take every step forward. But we cannot let up. Look at where our work is leading us. We've shown you this map before. Boy, that's really tough on our monitor. Oh, it looks much better up there. This is a map that not that many days ago, this is the 21 counties in New Jersey, and it measures the virus in terms in each county of how many days it's taking to double. It wasn't that many days ago that we had red, which was it was doubling, within a couple of days, and orange. Now, as you can see, we have no red. We have not had red for a while. We've got three, as I can see that with my weak eyes, I believe 3 southern counties are in orange. A whole bunch are in yellow, and increasingly, including my own county, you've got counties that are doubling in at least, if not more, than 7 days or more. And that is a very good early sign that we are beginning to beat this virus back. We're slowing the rate by which new cases are doubling, which is an important metric, and Judy and Christina will I think back me up on this. And again, the lighter each county gets in this map, the more we're flattening that curve. We remain confident that the course we are on is the right one, and that if we all continue with what we need to do, keeping our social distances, wearing a face covering when we're out, which we all do, we only take off for the purposes of this press conference, and otherwise staying home, we will win this war. And remember that wars are not won overnight or by set dates. They're won through perseverance and hard work, and together we are doing that hard work. And again, remember, I keep coming back to Churchill in many respects. Never have so few done so much for so many. Well, it turns out it's both fronts, both ways right now in this war. We have two fronts, one for the many and one for the few. The one for the many is all 9 million of us staying home, keeping our distances, wearing masks, and basically keeping that social distance mantra as we pound this curve into the ground. Remember the positive tests I mentioned earlier? They're up, the curve is flattening, but they're still going up. We cannot, we're not in the end zone, folks. We cannot spike any footballs. We're not even first and goal. But if we keep all 9 million of us pounding on that curve downward, you'll have fewer infections, fewer hospitalizations, fewer intensive care unit hospitalizations, fewer needs for ventilators, and please God, fewer fatalities. That's what the many of us over here could do. The few are heroic healthcare workers, first responders, the folks who are at the front line of this war, working on behalf of all of us. They are showing that heroism every day, and we have to let them continue to build out the capacity in our healthcare system such that we've got enough beds, ventilators, medicine, healthcare workers, by the way, we'll come back to that in a minute, intensive care beds, personal protective equipment, all that contributes to that healthcare capacity over here, such that as we pound the curve down over here, the 9 million of us, the heroes over here, that we can get lines that cross in a reasonable level at a reasonable time, such that the folks who do get infected and require hospitalization and require intensive health care oversight, that we've got a system that has the capacity to manage those persons. We are literally at the edge on all of what I've just described. Our job must continue to be, and I know it's hard, the weather's warmer, tomorrow's Easter, please God, stay the course, stay with us, keep pounding the curve down. Let's get that map to be all whatever that color is. Is it gray? I think it looks gray. I'll say it's light gray. Let's get a light gray state and even then some. And then we can say to ourselves, you know what, we are on the road to victory. And by the way, unequivocally, if we all do our part, and I know we will, because we're New Jersey and nobody can touch us, we will beat this virus and we'll come through this stronger as one New Jersey family, stronger than ever before. Okay, so as it pertains to our continued efforts, today I'm announcing another step, building upon the step we took on Thursday to help slow the further transmission of coronavirus. Today I am signing an executive order directing NJ Transit and all private carriers to cut the capacity on all trains, buses, light rail vehicles, and para-transit vehicles to 50% of their maximum. The order further requires NJ Transit and the private carriers to supply their workers with gloves and face coverings. The order also requires all riders to wear a face covering when traveling either on NJ Transit or with a private carrier, whether it be by bus, train, light rail, or paratransit vehicle, unless they cannot, by the way, for medical reasons. Right now, for many of our essential workers, public transit is how they get to work, and we need to protect them during that trip. NJ Transit will put out guidance specifically on this executive order, and so that we have a rational execution of this order. There's going to be a fair amount of discretion left up paramount to our drivers. Additionally, part of the same executive order, I'm expanding the requirement to wear a face covering to all customers heading into one of the restaurants and bars that remain in operation as they get their takeout orders. If you are not walking into an establishment, if you're doing it, say, curbside, or if your order is being delivered to you, a face covering will not be required. And we will require that restaurants and bars give face coverings and gloves to all their food service personnel. All of this is effective, I believe, Monday evening at 8 p.m. So thank you for that. It bears repeating, and Judy would get mad at me, and I do not want her mad at me. A face covering, and Christina would do the same, I believe. A face covering does not mean a medical grade mask. We need to keep those for our frontline public health and safety responders, and they remain, I might add, in short supply. There are any number of ways you can cover your mouth and nose with a bandana or a homemade fabric covering. And I know for some of you, you may view this as just another inconvenience. Remembering to bring your face covering to the supermarket or now to pick up your takeout order may be a hassle. But you know what would be really inconvenient is if you ended up in the hospital with COVID-19 or you inadvertently infected a family member, maybe of an older generation, with the virus unwittingly. And if you did that just because you didn't take to heart the need for us to take every precaution and for all of us to keep working together. So we accept this is inconvenient. We accept the level of anxiety. We accept we all want to be outside doing as we would normally do it at this time of the year. Here's the problem. If we do any or all of the above, we blow our chances of flattening this curve. You probably put yourself or your family members personally at risk, and I can promise you we put our health system at risk. We just can't do that. So folks, again, I thank you from the bottom of my heart. This will have been worth it. I know we're going through hell and back, but we will get through this, and we'll get through this together. And speaking of working together, we continue to benefit from the generosity of countless businesses and individuals who are donating much-needed personal protective equipment and other supplies for our frontline workers. I must give a huge shout-out to the Joe and Clara Tsai Foundation, which has stepped forward and delivered 150,000 surgical masks and nearly 198,000 N95 masks. These are sorely needed for our healthcare professionals and first responders. So to Joe and Clara Tsai and their team at the Tsai Foundation, we cannot thank you enough. I had the honor of speaking with them, I think it was a week ago today. It was back and forth on a text with Joe this morning. They are each extraordinary individuals. They've got Jersey roots in their lives. They are, and I could say this because it's public knowledge. A couple of years ago, they gave the largest gift ever to the Lawrenceville School, which is not too far from where we're sitting right now. Joe is a co-founder of Alibaba. He is the owner of the Brooklyn Nets. And by the way, Pat, before you ask, as part of the deal, there was no discussion of returning the Nets to New Jersey, in case you're wondering. Clara herself is a leader of the Reform Alliance. She is a graduate of Stanford, as is Joe, I believe, and they have given mightily to Stanford and worked with Stanford on a whole range of initiatives, University of Washington, etc. So to Joe and Clara, if you're watching from La Jolla, from the bottom of our hearts, we say thank you. I also want to give a big thank you to Mallinckrodt Pharmaceuticals, which is sending a shipment of 100 gallons of hand sanitizer our way, and this too is greatly appreciated. To our friends at Mallinckrodt, we say thank you. In the same vein, we are grateful to Precious Cosmetics for their donation of 100 bottles of hand sanitizer as well. Thank you for Precious Cosmetics. And if anyone out there has more PPE or other supplies to donate, let us know. Please reach us at covid19.nj.gov/PPE donations. Also, this is a big one. Yesterday, a total of 78 ambulances and EMS squads from states across the country, and with them carrying 139 EMTs and 56 paramedics, came to assist our local teams, and not a moment too soon. 53 teams were basic life support, and 25 were advanced life support. These folks and these ambulances came from places including California, Illinois, Ohio, Pennsylvania, and Maryland, among other states. And last night, they were already on the streets across our state, including in Newark and Jersey City, Patterson, East Orange, Irvington, and New Brunswick. They know how hard our EMS squads are working and how overloaded many are, and they came in mutual aid and support. This is a true brotherhood and sisterhood, and we've already lost, as you know, 4 precious and tremendous EMTs to COVID-19. Yesterday showed, among other things, that we all have each other's backs. And to those who have come from afar to help us, we will return the favor in your time of need. We always have, and I will say again, we always will. We planned for this. This was not a coincidence or an accident. We planned for this weeks ago, and I give a lot of credit to the folks on either side of me here. We knew we would have EMS capacity, EMT and ambulance capacity challenges, so we planned for this. We worked with FEMA and the National Ambulance contracts. And I want to give a particular shout out here to the New Jersey EMS Task Force headed by Mike Bascom. So to the squad in Jersey, to my colleagues, to our friends at FEMA and the administration, and most importantly to the folks who have come from afar to help us in our hour of need, we thank you from the bottom of my hearts, and we will never forget. From across the country and truly around the world, we are moved by the generosity of so many. We also continue to be overwhelmed by thousands of people who have contacted us willing to step up and volunteer in our fight in any way. I believe Judy said over 18,000 folks have raised their hands. And Judy's going to go through exactly, some of you have asked, what are we doing with those folks who raised their hands? Judy's going to give you a little bit of color on exactly what's going on. But we continue to have direct and essential needs for healthcare volunteers to assist, in particular at our field medical stations. Specifically, we continue to need individuals with experience, Judy, am I right, as either a chief nursing officer or a chief medical officer to help run these sites, as well as for physicians and respiratory therapists. Judy's also going to go through an update on status, I think, on the USNS Comfort, which, by the way, is captained by a Jersey guy, graduate of Red Bank Catholic. More on him at one of our future gatherings. I urge you, if you have these skill sets that I just mentioned, in particular chief nursing officer or chief medical officer, please reach out to us at this website, covid19.nj.gov/volunteer. Switching gears just for a minute, I'm happy to say that the National Governors Association is going to make an explicit ask on behalf of all states for $500 billion in direct state aid that would come directly to states that we in turn can then use to back and fill the extraordinary efforts at which we're on the front line of attack. Everything from helping unemployed folks to small businesses to clearly caring for those in our healthcare system. I've said this now on many occasions, we are desperately in need of direct cash federal assistance directly to states. And I'm very happy that the NGA is going to make that explicit at a number which we think is at a minimum what is required around the country, and New Jersey needs its share of that. I also want to repeat, I think we were the first state to raise our hand. I know I'm joined in this by Governor Cuomo and others, Speaker Pelosi. Please, God, folks in Washington, if you're watching, can you lift the cap on the SALT deduction? I hope permanently, but can you at least lift it for some period of time? This was a crushing blow to our homeowners and property taxpayers in New Jersey, and we need that lifted. So please help us in that regard. Let me switch gears to testing. Tomorrow, Easter Sunday, our FEMA-partnered testing sites at Bergen Community College and the PNC Bank Arts Center will both be closed. Next week's schedule for each site will be posted on our information hub at covid19.nj.gov/testing. And on that page, you can also find information on the 18 other public testing sites being run in counties across the state. But there are quite literally, as I've said, dozens more testing sites that are available to you if your primary care practitioner determines you meet the requirements for testing. I think I said this as of yesterday or Thursday, that number is at least at 57 around the state. And before I hand the briefing over to Judy, I'd like to keep highlighting some of the good things happening in our state. I want to give a shout out to all the essential workers out there, especially those who remain on call this weekend, this holiday weekend. And a special shout out to the child care workers who are making sure the kids of our essential workers are being properly looked after. It does indeed take a village, in this case an entire village. As my late dad used to remind me of that famous quotation, I am the Alpha and the Omega, the beginning and the end, as we sadly commemorate the loss of life in this state, it is important for us to remember that in other respects, the natural course of human history goes on. And for the deaths that we mourn together, we also acknowledge and celebrate the births among us. I want to give a shout out to our good friends David and Laura Pascal, who announced the birth yesterday of their new daughter, Isla. I believe Isla Marie, and she joins their son, John. So bless those who are being born into our state at this time when we mourn the loss of life. To each and every one of you, to all of you, you keep sending us great stories on social media by using the hashtag #NJThanksYou, and I urge you to keep on doing it. Let me give you a couple before we turn over to Judy. Here's a picture of Montclair's David Plassick. David is a landlord with a dozen tenants, and he stepped forward to give every one of them a rent holiday through June. 3 months rent-free. Now, certainly not every landlord is in a position to do the same. We get that. But David exemplifies the spirit we need to see right now of people stepping up to make sure others can come out of this emergency stronger, and so we all come out of this stronger. Hats off, David. And just this morning, I believe, was it this morning? The man to my left, Colonel Pat Callahan, went over to Warren Hills High School, near his home, I might add, where his own kids went, where student and faculty members from there, and nearby, I believe, Mount Olive High as well, assembled 15,000 face shields that will be donated to our healthcare workers. These two schools are often rivals on the playing field and in the gym, but today they showed how we're all coming together to help others. I knew the tip of the iceberg on that all coming together was when I saw Jets fans on the streets of New York applauding a New England Patriots truck bringing face masks. I knew that we had gone to a different place as a country and as a region. This is the spirit of community that is evident all across our state. Even in the face of anxiety and uncertainty, we're coming together because we know that when we do, we will get ourselves through this as one. And I think that's as good a way to think of this Easter weekend, too. And it's the way I will be celebrating Easter tomorrow with my own family. Yesterday was Good Friday. But the first Good Friday, by the way, wasn't very good. It was filled with pain, doubt, and fear. But from that day came our faith in rebirth for those who celebrate Easter. And our faith in rebirth in the resurrection of life, of healing, of resilience, and of hope and happiness, because our anxiety and fear and sadness may endure for a night, but joy will come in the morning. We're going to get to that better morning. We're going to get there together. But to get to it, we have to keep doing everything we can over here to flatten the curve and get out ahead of this virus and stay ahead of it, so the heroes over here can treat the sick and get as many of them as possible back on their feet. Tomorrow is especially a day, and I plead with you in particular, just as the first night of Passover was, tomorrow, Easter Sunday, is a day when we cannot let up our social distancing, and as much as we would love to, we can't. Live stream an online service, or read the scripture at home with your family via FaceTime or Zoom, or maybe just over the phone. Take a moment to speak with your kids as to the importance of our having to be apart for the days ahead, so we can get back together, not just for next year's Easter and Passover, but for the many years and decades to come. Stay safe, stay healthy, keep your faith. We are going to win this together. With that, please help me welcome the Commissioner of the Department of Health, the woman who needs no introduction, Judy Persichilli.
Thank you, Governor. Good afternoon. As predicted, we expect the next 2 to 3 weeks to be especially stressful and difficult for our hospitals and our long-term care facilities. As the governor shared, there's 7,618 hospitalizations right now, or as of 10:30 last evening, in our hospitals with COVID-19 positive patients and those persons under investigation. Additionally, 1,746 of those individuals are in critical care beds, and 1,650 of those individuals are on ventilators. Today, I'd like to provide you with an update of our tiered system of expanding bed capacity that allows our hospitals to care for the most critically ill patients, while care is provided for others in alternative settings based on their level of need. First and foremost, all of these initiatives are dependent on a reliable workforce. 18,300 volunteers have registered on the NJ COVID-19 Information Hub as of April 7th. Contact information for 1,400 nurses has been sent to facilities for staffing as of April 10th. 330 RNs and LPNs, their information has been sent to facilities run by the Division of Military and Veterans Affairs. 500 RNs have been sent to hospitals in the central region, and 383 nurses, their information has been sent to the alternate care sites for follow-up. We're taking a tiered approach to bed capacity. Tier 1 and 2 are units in hospitals for the most critically ill and those graduating out of critical care but still requiring an intensive level of care. Tier 3 is for patients who require medical surgical interventions and are appropriate for a hospital stay. These patients will go to the alternative care sites, we're calling them the bricks and mortar care sites of closed hospitals that we're standing up to receive these patients. That will be in Woodbury, East Orange, and Barnard Hospital. Tier 4 is for patients who need vigilance for 1 to 5 days, or what we call lower acuity medical care. They will receive care in the 3 field medical sites set up by the United States Army Corps of Engineers and the New Jersey State Police. Currently, there's 20 patients at the Meadowlands Convention Center federal field medical site in Secaucus, which has a capacity for 250. We expect by evening to be caring for 50 patients in that site. The Edison Exposition Center has been set up as a field medical site, and they will have a soft opening today. It has a capacity of 500, and we expect about 20 individuals in that site by evening. The Atlantic City Convention Center will be set up and will have a capacity of 250 beds. Tier 5 is actually convalescent care, and that's care that can be rendered safely in hotels for healthcare workers to maybe crash and get some rest, or it will be healthcare workers who have tested positive but are asymptomatic and need to isolate and cannot do safely at their own homes. And finally, Tier 6 are dormitories like at Rutgers University and will accommodate asymptomatic individuals who may not have a place to go, perhaps the homeless or other vulnerable populations, or need to quarantine for up to 14 days. Additionally, as the governor shared, we've just gotten word that the USNS Comfort will be accepting admissions from our hospitals in New Jersey for mid-acuity medical surgical patients. We thank them, and this is really excellent news, particularly for those hospitals in the northern part of the state. As I've shared in the past, our nursing homes continue to be a significant focus. Today, the department will be sending the following guidance out. COVID-capable facilities. They are those that can care for residents while implementing all of the infection control protocols, including but not limited to cohorting and sufficient staff to do so. And these facilities can admit new patients or readmit residents back. COVID struggling facilities. These are facilities that are not able to cohort due to but not limited to the inability to implement infection control protocols or physical plant constraints, and these facilities will not be allowed to admit any residents or readmissions. And COVID-negative facilities, those few facilities that have no negative patients at this point in time, they can admit patients or unless they cannot implement infection control protocols. Any facility that cannot implement infection control protocols cannot admit or readmit into their facilities. These facilities should admit residents or readmissions, again, only if they can meet all of the infection control protocols. As I said the other day, we are working with long-term care facilities that will allocate 100 to 200 beds in the northern and central part of the state so that hospitals can safely transfer their nursing home facility patients into those facilities when they cannot be admitted to COVID struggling or COVID facilities that are struggling to maintain infection control protocols and need a place to convalesce. Changing gears, as the governor says, at our 4 state psychiatric hospitals, there have been a total of 160 staff and a total of 80 patients that have tested positive for COVID-19. There have been 5 deaths among residents that have tested positive. We are working with those hospitals to conduct surveillance and implement infection control protocols to reduce exposure. Today, we are reporting 3,599 new cases for a total of 58,151 cases in the state. And sadly, 251 new deaths have been reported to the department. 148 are male, 103 are female. They range in age from 23 to 100 years of age. Underlying medical conditions are evident in 97 of these individuals. 15 of these new deaths were residents of long-term care facilities. There are 305 long-term care facilities right now in the state that are reporting at least one COVID-19 case. There are now 2,183 fatalities in our state. The underlying conditions that we know for 1,083 of them are 29% cardiovascular disease, 17% diabetes mellitus, 15% other chronic diseases, 10% chronic lung disease, asthma, emphysema, COPD, chronic obstructive pulmonary disease, 7% chronic renal disease, 7% neurologic or neurodevelopmental disabilities, 6% cancer, 6% other, 3% none. The racial breakdown is known for approximately 1,350 of these cases, and they are 704 or 52% white, 298 or 22% are African American, 237 or 17% are Hispanic, 79 or 6% are Asian, 38 or 3% are classified as other. The families of all of these individuals are in our thoughts and prayers. Thank you again for staying home and following social distancing guidelines. We know this is especially tough during religious holidays like tomorrow, when we normally are coming together. While difficult, it is vital that we continue this effort to slow the spread of COVID-19. As we observe Passover this week and celebrate Easter tomorrow, we join together to wish everyone happy holidays, stay home, stay connected, stay safe, and stay healthy. Thank you.
Thank you, Judy, for that and for all. A couple of things, if I may. Top 5 counties, a little bit of a shift in terms of total number of positive cases. Bergen continues to be 1, Essex 2, Hudson 3, Union 4. But now, as I mentioned yesterday, Middlesex and Passaic were sort of in the same neighborhood. Middlesex is now slightly ahead with more positive cases than Passaic. So those are the top now 6 counties. I meant to mention schedule, and Dan Bryan will correct me if I'm wrong. Tomorrow we will give you any overnight developments as it relates to the blessed lives we may lose, as well as positive test cases.
This has been a special report from CBS 2 News.